Lynchburg Police Department teaming up with Horizon Behavioral Health to start what they're calling a co-responder program in the Hill City. The program will pair one trained police officer with a Horizon crisis intervention specialist so that they can better respond to mental health calls. WFXR's Anna McDougall joins us live from Lynchburg. Anna, you talked with both Lynchburg Police and Horizon earlier. What do they hope to see out of this program?
The Lynchburg Police Department says that they're responding to mental health related calls on a daily basis, and those number of calls is just continuing to rise. But they hope this new partnership will not only help them better be able to help people who are in these mental health crisis situations, but also ease the burden on police officers.
Just in the last 3 to 5 years, calls for service involving anyone with a mental health crisis has dramatically increased.
When someone is experiencing a mental health crisis, police are often the first people to arrive. But sometimes they're also the last people that someone struggling wants to interact with.
The goal of the program is to really get the right person connected to that individual that's experiencing that mental health crisis and to try to get it de-escalated in the best way possible.
The partnership with Horizon will pair an officer with a trained mental health expert who can provide better on-scene support for the person experiencing a crisis.
To be able to try to get the mental health responders to the person in the community rather than trying to get that individual to the mental health to the mental health clinician.
Lieutenant Coleman adds that right now, if the person is taken to the hospital, it's the officer's responsibility to stay with that individual, drastically reducing the police presence in the community.
They will have to sit with them for hours upon hours, could turn into days, and therefore taking that police officer off of the street.
He says on any given day, they could have about half of their on-duty officers at the hospital, but with this partnership, the mental health expert will be able to stay with the patient while the officer continues working.
Having a program that helps us get to that individual decreases the stigma around having a mental health concern or some mental health symptoms.
Now, Lieutenant Coleman says that this person will have to undergo training, including self-defense. He also says that the officer will always go in and check the situation out and assess the scene to make sure it's safe before the mental health expert can enter and begin trying to help this person undergoing this mental health crisis. I'm live in Lynchburg, Anna McDougall, WFXR News.